The most common type of stroke is a signal stroke. This stroke happens when a blood clot or fat deposit called a plaque blocks an artery supplying blood to the brain. The symptoms of this stroke are sudden weakness in the face, arm, or leg, difficulty in speaking, dizziness, difficulty walking, and vision loss or double vision. Another kind of stroke is hemorrhagic stroke. This stroke happens when a blood vessel in the brain leaks or ruptures. The symptoms of deep stroke include confusion or disorientation, seizures, dizziness, loss of balance, trouble with speech, and weakness in one side of the body's face, leg, or arm.
Transient ischemic attack, TIA in short, usually happens when there is a transient shortage of blood flow to a portion of the brain, which causes stroke-like symptoms that usually resolve within 24 hours. It is caused by blood clots that are usually temporary and are reabsorbed quickly, restoring proper blood flow. Common symptoms for TIA are numbness or weakness in the face, arms, or legs, sudden confusion, and trouble speaking. Brainstem stroke, on the other hand, happens when blood supply to the base of the brain is stopped, which affects many functions in the body. Symptoms may include muscle weakness, hearing and vision problems, as well as sensory changes.
Side effect of the left hemisphere of the brain stroke is Broca's and Wernicke's aphasia. Both Broca and Wernicke's area are located in the left brain hemisphere. Each aphasia is a type of language impairment. Broca's aphasia is difficulty in producing speech, while Wernicke's aphasia is when a patient struggling with speech comprehension. And next, patient will have a problem with complex decision making, language, reasoning, and judgment and attention, and also will have a very poor skills in memorizing, which is shown as a condition called cognitive impairment. Finally, homonymous hemianopia is a condition that results in the loss of either left or right half of visual field of both eyes. This is because the occipital lobe, which is important for visual processing, are damaged due to stroke.
The result of a right hemisphere stroke is loss of movement and control of the left side of the body. Injury to the right side of the brain may result in a loss of capability on the left side of the body. The next result is unilateral neglect. Unilateral neglect refers to an unawareness of item on one side of the body or personal space. The stroke in the right hemisphere will also cause anosognosia. Anosognosia is a neurological disorder in which the patient is ignorant of their neurological deficiency or mental illness. The following impacts include loss of hearing and musicality. A stroke survivor in the right hemisphere may have problems picking out on particular sounds, which might result in misunderstanding or an inability to appreciate the musicality of speech and tone completely.
Recovery cognitive function for first week, first 3 months, and after 6 months. During the first week, the stroke care team will analyze the impact of the stroke, which will define the rehabilitation plan. The stroke will have long-term repercussions for individuals depending on the stroke severity and the region of the brain affected. For instance, physical and occupational therapy can help to identify which areas of the brain are damaged when performing different activities with a patient, such as cognitive symptoms, memory problems, difficulty of speaking, and walking. Speech therapy can be helpful for people who have swallowing problems as a result of stroke or after effect of using a breathing tube. Activities of daily living become the emphasis of rehabilitation following a stroke. One way of activities of daily living are patients can talk with their care team about activities that are important to them, such as practicing a work-related skill or hobby to accelerate their recovery goal.
The next part is recovery cognitive function after 3 months and 6 months. During the first 3 months following a stroke, a patient could experience a phenomenon termed spontaneous recovery. Spontaneous recovery occurs when a skill or aptitude lost due to a stroke recovers abruptly as the brain discovers new ways to carry out activities. While spontaneous recovery occurs most of the time, we may boost the number of talents you recover by utilizing your brain's neuroplasticity. The ability of the brain to develop new neural pathways is referred to as neuroplasticity. This enables the brain to move functions that were previously stored in damaged areas to new healthy ones. As the data demonstrates, the rehabilitation continues from early rehabilitation until late therapy about 6 months. As we can see after 6 months, this is the chronic phase stage. After 6 months, gains are considerable but will be significantly slower. Others will have continuous deficits, commonly known as chronic stroke disease. Whether a complete recovery is feasible depends on a range of circumstances, including the severity of the stroke, how soon the first treatment was offered, and the kind and intensity of rehabilitation.
One of the recovery effects after stroke is angiogenesis. Angiogenesis is the regrowth of new blood vessels, and this regeneration is beneficial for stroke patients. Even if angiogenesis occurs only transiently in the ischemic hemisphere cortex, it may function to eliminate damage issues. The non-pharmacology interventions like exercise and low-level laser therapy and the pharmacological interventions such as statins can improve recovery of angiogenesis. Hence, angiogenesis can help the restoration of blood supply, providing oxygen and nutrients to the ischemic brain tissue, which is beneficial for stroke recovery.
Secondly, the next is unilateral spatial negative, and we can call it USN. As we know, each hemisphere of the brain is responsible for controlling the opposite side of the body, and a stroke will damage it. So, the USN patient cannot see the object on the one side which is damaged, know that they have sensory deficit, but they cannot pay attention. Actually, nearly 50% or half of the USN patient caused by a stroke can be cured, but they must actively do the treatments. Example is visual scanning training, sensory stimulation, limb activation, and so on. This activity will increase the metabolism of both hemispheres and make the brain recover completely. Last but not least is cognitive function. As we know, a stroke will cause the blood vessel in the brain to become abnormal, and it will affect the surrounding nerves. So it causes the capacity to control the body deteriorates and cognitive function deteriorates. So therefore, have studies show that physical activity after a stroke can enhance cognitive performance. It is because for 3 main reasons, which are: first, reduce depression symptoms; second, improve cognitive alertness and wakefulness; and the third is the increase the brain neurotransmitters like dopamine. As a result, it is significantly shown that increasing physical activity after a stroke will improve cognitive function.